Blood glucose monitoring is an important part of diabetes care. Although most of your students will be able to check their blood sugar themselves, this video is meant to review with you the steps through the procedure in the event that you should ever have to do it. The equipment you'll need will include alcohol and either a couple cotton balls or gauze pads, a lancet device, blood glucose monitor strips, and a blood glucose monitor. You'll notice on the blood glucose monitor strip that one end is meant to go into the blood glucose monitor, the other end is meant to receive the blood specimen. Before testing blood glucoses, students should wash their hands well with soap and water and dry them completely. Next, let's get the equipment ready. So take your lancet device and remove the cap on the end of it, exposing the area where the lancet will be placed. Pick up your lancet and put it in. As you do, push it in till you hear a click. This means the lancet is engaged and ready to prick the finger. Twist gently and carefully to remove the cap on the end of the lancet to expose the needle and replace the cap. Next, let's get our glucometer ready. So take the blood glucose monitor strip and insert the end that will be received by the monitor into the appropriate hole. This will turn your monitor on, and a graphic will come up to indicate that it's ready to receive the blood specimen. Let's go ahead and get our blood specimen then. So take one of the cotton balls or gauze pads, put alcohol on it, and clean the side of your fingertip. Take the dry cotton ball and wipe it to allow it to dry completely. Next, take the lancet device and press firmly against the side of the fingertip that you just cleaned. Pushing the button engages the lancet, and the click will let you know that it has worked. Gently squeeze the finger to get a drop of blood. Take the dry gauze pad and wipe it off, and then squeeze again to get a nice drop of blood. Once you have the drop of blood, pick up the glucometer with the strip already inserted and put the side of the strip where the blood is received against the blood droplet. Your glucometer will process and a number will pop up. This is the blood glucose. Be sure to document that in the blood glucose log. Be sure then to dispose of the strip as well as any cotton balls, and carefully remove the lancet from the lancet device. The student should do this for themselves. However, if you end up having to check blood glucoses, be sure to wear gloves since blood is involved in this procedure. And that is what you need to know to be able to adequately and safely check blood glucoses.